This is what bronchitis sounds like. You can have bronchitis for months, and it can develop into asthma or pneumonia.
Oops. Doctor, why is she having some bad cough? Is it some sort of allergy as well?
Lillian, this is a typical case, as we can see here, this is a typical case of allergic bronchitis. The patient knows it's a very persistent cough, and she is having overproduction of the mucus, and she is not able to breathe properly, and the cough is not subsiding with anything. The cough is only going to subside with the bronchodilators. It's basically what we call as allergic bronchitis. There is excessive production of mucus. The patient is coughing persistently and it's not getting relieved by any other thing. So only when the patient takes the bronchodilators, this cough is going to get relieved. So this is a typical case of allergic bronchitis which is leading to asthma. So you should always remember that to take care of these things, bronchodilators are the only thing that can get relieved of such a cough.